Hi, this is Team 3, Ilan, Connor, and Irina. Today we'll be talking about HIV and AIDS in the European Union, and we'll discuss a model for distributing resources in a medical crisis. Here is our agenda. Overview of HIV and AIDS, European Union cross-border policies, objectives as where to invest resources to manage HIV and AIDS impact, data, analysis, recommendations, and next steps. So what is HIV? HIV is human immunodeficiency virus. It's a virus that affects human immune cells and weakens the immune system. There are 3 stages of HIV infection. Stage 1, acute HIV infection. In this stage, people usually experience flu-like symptoms that last for a few weeks. Stage 2, asymptomatic stage. Patients typically have no symptoms, and this stage lasts for several years. Stage 3, onset of AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. People who have AIDS suffer from severe illnesses such as cancer and pneumonia. Without treatment, their life expectancy is 3 years. HIV spreads through certain body fluids, through unprotected sex, sharing of needles, and blood transfusion. HIV diagnosed through blood and saliva testing, including antigen antibody test or nucleic acid test. There is currently no cure for HIV. Antiretroviral therapy, we'll be referring to it as ART from now on, can help control HIV by preventing transmission as well as development of AIDS. ART is a combination of 3 or more medications from several different classes of drugs. Cost of ART therapy depends on the country. For example, in Switzerland, cost of ART therapy per patient per year is more than 20,000 euros, while in Slovakia, the cost of ART treatment per patient per year is 1,000 euros. One of the reasons we are studying the European Union is because of their unique universal healthcare system, which allows for cross-border healthcare. Cross-border healthcare is when a citizen of one European Union country can receive treatment in another. This practice is very common because of disparity in healthcare infrastructure between neighboring countries. Almost 200,000 patients a year resort to cross-border healthcare. France had the highest number of outgoing patients, and Spain, Estonia, and Germany were the most popular destination for cross-border healthcare. Our objectives. We want to identify key predictors of European Union states that require additional resources to treat HIV and AIDS, and also we want to recommend where and what resources to invest to most effectively treat HIV and AIDS and lower its impact on the population. We identified several organizations that could be interested in our research. The first one is the World Health Organization, or WHO. It will help them to improve overall regulations. The next one is European Commission and Ministers of Health. It will help them to improve the implementation of any public health initiatives. And the last but not least, pharmaceutical and medical device companies. It will help them to modify strategic operations in the region and capitalize on opportunity and meeting needs. We derived our data from European Centre for Disease Prevention and Control Annual HIV Surveillance Report, from WHO and the World Bank database. Our dataset includes the following information for 19 countries out of the 27, and the range is from 2016 to 2015. Here is the data. Population density, HIV transmission rates, AIDS transmission rates, death rates, ART coverage, GDP per capita, and total HIV cases.
So looking at the tools that we use to analyze our data, we used Tableau to better visualize it and form hypotheses. We then used Excel to organize and refine our data set and paint a big picture overview utilizing correlation matrices, and we ran linear regression. We also used Python to run logistic regression and run hierarchical and k-means clustering analysis. This data shows total number of HIV cases from 2005 to 2015 in the European Union. Here we can run the data and see that as the colors shift from a light orange to a deeper orange color, the increasing number of total cases. And on the right, we see the total cases in 2015. So based on these visualizations, we initially thought that France and Germany would most likely require additional investments and resources to aid HIV and AIDS treatment because they had the most HIV cases over the years. However, as we looked into the data more, the results were quite different. So we ran linear regression in Excel, and on the bottom left here we can see some of our summary output. Here the X variable is the AIDS transmission rates and the Y variable is death rates. You can see that the correlation is pretty high at 0.9. And on the right, we just plotted that. So the blue dots are the actual observations, and the orange dots are the predicted Y values based on our regression equation with the trend line running through them. So we've stepped into our Excel regression model here, and we can see that in the top left, our variables are the same as what we had on the previous slide. But let's change AIDS transmission rates to HIV transmission rates and plot the difference. So we can see that the correlation is much less than with AIDS transmission rates and death rates, even though the beta is still pretty significant here. But this lower correlation just really stresses the importance of early treatment of HIV before it evolves into full-blown AIDS. We can also use this model to take a look at some of our time series analysis. So we plotted each country's HIV transmission rates over time from 2005 to 2015. And we can see for a country like Austria that the HIV transmission rates are pretty steadily decreasing. If you look at a country like Romania, for example, we see quite the opposite, with pretty drastically increasing HIV transmission rates over time. We can then just chart all these, just automated a charting process to run through our variables to really get a high level overview of the data and visualize what the correlation looks like. To run this logistic regression in Python, we created dummy variables for related death rates. Death rates below 100% equals 0, and death rates above 100% equals 1. We made this assumption that death rates above 100% indicated an overwhelmed healthcare system. Based on our research, these statistics could be explained by foreigners coming in to receive treatment too late and having their death registered in that country instead of their home country. Accuracy of this model is fairly high at 85%, and the precision of the model predicting a 1 or overwhelmed healthcare system was 100%. Also, the AIDS transmission rates had the strongest correlation with high death rates, confirming our previous finding in Excel. Additional logistic regressions with other variables included population density and GDP per capita were used, but none were promising predictors of high death rates. We ran logistic regression on Python to look for correlation between ART coverage, new HIV cases, and HIV transmission rates. We decided to run boxplot to get a better understanding of data distribution and potential outliers for ART coverage and new HIV cases. For this data set, we dropped missing values and created dummy variables for ART coverage, where values below 58, which is medium number of ART coverage, were coded as less, while values at 58 and higher were coded as more. The output suggested that the data is not evenly distributed, and there is a greater variance among lower than average ART coverage due to the multiple outliers. Based on the correlation table, ART coverage has strongest direct correlation with new HIV cases at 0.57. However, the classification report suggests accuracy of only 74% and relatively low F1 scores. It suggests that our model is not very reliable. Here we see some pair plots that we created in Python with different color representing each country. And the pair plots show Romania, Spain, and Italy having the highest death rates despite low HIV and AIDS transmission rates. We ran hierarchical clustering analysis using the Ward method and produced this dendrogram. 3 clusters seem to sufficiently separate the majority of the data in distinct groupings. The height of the branches indicate degree of difference, so the longer the branch, the greater the distinction. And this is further supported by the scatter plot since there is very little overlap between the data points. Countries with high death rates and low transmission rates are shown in yellow. These countries are Romania, Spain, and Italy, and this coincides with our observations from the pair plot. This elbow chart showed that the 3 clusters was best for our k-means analysis because at 3 clusters, the k-means variation line flattens, implying that additional clusters would not improve our model's accuracy. Based on scatter plots, we identified outliers to the upper left corner, and these observations belong to Estonia and Portugal. We decided to run a box plot to get a better understanding of data distribution and potential outliers for ART coverage and new HIV cases. For this data set, we again dropped missing values and created dummy variables for ART coverage, where values below 58 were coded as less and values at 58 and higher were coded as more. The output suggests that the data is not evenly distributed, and there is a greater variance among lower than average ART coverage due to multiple outliers. Now Elon is going to talk about the results from our analysis.
So based on our analysis, we were able to identify two variables EU states should consider when managing the spread of HIV/AIDS. The first are actual AIDS transmission rates. This is the best predictive death rates of all the variables we evaluated based on our Python model, which ran with an 85% accuracy and a correlation of 0.47. The second was ART coverage. We found that ART coverage is the best predictor of new HIV cases in a country with 74% accuracy on Python and with a correlation of 0.57. And then based on our clustering analysis, we found specific countries that require additional attention. The first group are Romania, Italy, and Spain, which had the highest death rates despite very low HIV and AIDS transmission rates. And so even though they have low transmission rates, it seemed from these results that their treatments are not sufficiently keeping the infection from advancing. The second group were Portugal and Estonia. These countries had very low population densities, but disproportionately high HIV and AIDS transmission rates. And so for this, we thought that it was more important for them to invest in preventative measures because that was lacking. So with these findings, we first recommend that Spain, Romania, and Italy increase access to ART treatments by building additional treatment centers, such as hospitals, clinics, or even just the space for doctors and nurses to see and treat more patients. Our second recommendation is that Estonia and Portugal should try lowering their transmission rates by implementing preventative measures. So there are a few options here, and they have worked in other countries. For example, they can invest in sexual health education in schools, provide PrEP medications at low cost or even free to vulnerable communities, implement needle exchange programs, and then provide anonymous and affordable HIV testing so that patients know if they're infected to avoid transmission. Our next step is to first assess the current situation of the countries we just listed. Our models were built off of historical data to provide the most complete and consistent data set for us to use, but in order to see if our recommendation is valid, or even if it will work in these countries, we have to have a better sense of how these countries are doing currently. And this includes collecting HIV/AIDS related data to identify the most underserved regions, as well as current location and number of HIV treatment centers within each country. We will then check the feasibility of our recommendations by performing a cost-benefit analysis. If we had more time, we would have included more research on the local laws and regulations in the country, as well as more details about their healthcare system. So for example, we would have liked to included information about their reimbursement models, their healthcare provider and patient ratio, as well as coverage for undocumented migrants. So that's it from us, but thank you all for listening, and we hope this presentation shed some light on how countries can better manage HIV/AIDS as well as other similar diseases. If you have any questions or comments, please feel free to reach out to us.